Hi there, I'm Dr. Chung, and welcome to your friendly proctologist. I'm so glad that you're here. Thanks for spending this time with me. I'm a board certified colon and rectal surgeon, or proctologist if you prefer, and I want to give you real useful information. Thank you for all of you who've been giving me feedback that these videos are actually putting you at ease. They're giving you ideas to help treat yourself, because that's the whole idea. I mean, there are a few in the comment section that say my videos are worthless, and well, I hope to do better for you this time around, right? I do offer video consultations to anyone in any part of the world. If you have an internet connection or a telephone, we can do things that way. There is a fee that applies to this service, and they're meant to be as helpful as I can be with us being long distance to each other. So today, I want to talk to you about burning poop, okay? When you get that crazy sensation, what the heck could that be? How do any of these scenarios fit your scenarios? Really what I'm trying to help you with, to try and identify is see if you match up with any of these things. Burning is a very subjective word, right? You may not interpret burning the same way I am, but I'm telling you, this is what patients tell me feels like burning, and I'm passing that on to you. You know, we're humans, we need to share experience, and if burning's what you qualify as, check this video out and see if it matches you. So let's get to it. The first reason we'll discuss that gives that burning sensation is chemical irritation. And you know, there are sometimes we're in the gym where you feel like you want to feel the burn, but here is not one of them. Some of the most common reasons are spicy food. Maybe you had an ethnic food or a diet that you're not used to, and it created maybe some type of allergic reaction. That could be another one there. But usually it comes about when the poop happens. The chemical that's in the food that you're digesting makes contact with the anal area, whether it's the skin or maybe it's around the hemorrhoid regions, and then that's what creates that sensation. So typically, if you avoid that food, it should not come back, and that's the most best treatment. Other things that could possibly help are steroid creams or just really a soothing cream, like for example, Preparation H, Desitin, Calmoseptine, coconut oil. You know, the list goes on and on and on. The topic of discussion today is so fitting, and I'm so proud to tell you about this partnership with Revival XR. They've been extremely awesome in giving solutions that are real and that really help, okay? This bath salt supplement is not just salts, it is oils. It is powerful natural organic supplements, ingredients that are working to try and soothe and heal the skin. We want to relax your muscles. You want the fragrances to provide that aromatherapy with it. And the list of burning diagnoses that I have, yeah, this can be extremely powerful to use with it. And I suggest that you try it at least once a day. Or with every sitz bath if you're taking more than once a day for sure. And give this a try and see if it helps you. They've been gracious enough to give us a discount on the Amazon page, so definitely get it with your Prime shipping and get on your way to healing. Thank you so much, Revival XR. Number 2 reason for this burning sensation is skin irritation. And what I mean here is there are wounds on the outside of your skin. Now, I'm not specifically talking about anal fissures. That's going to be later because this is different. This feels like it's more on the outside and kind of comes in a little bit. It can, but the wounds, when you look with a physical exam, there might be hairline cracks. Maybe the skin is thickened a little bit, and the usual cause is friction. So using too much toilet paper, maybe using that washcloth a little bit too much, maybe you're rubbing too hard even with your hands, maybe it's because your skin is very irritated when you're walking and you walk a ton at work. You can see there's a lot of reasons why you can have a lot of friction there. Maybe you went on a big hike and you went on a hiking trip and you usually don't go hiking. You get the idea here, and the most common reason for that, or a common solution, is to stop the irritation. Definitely don't use your hands. Try to use a contact-free washing method. Use Desitin, which is a zinc-based ointment, which is heavy and thick and lasts a while. And then trying to figure out where the contact is and see where you can decrease that so the skin gets a chance to heal on its own. Anal fissures are another very common reason for burning poop, and this pain can be very sharp, super intense, and definitely when the poop is coming out is when people will feel this burning, searing type of pain. The more common way to describe anal fissures, however, is more like glass shattered or like cutting through, but burning definitely can be falling along those lines. Maybe you feel a little combination of both. For treatments of anal fissures, definitely check out my videos on anal fissures. I've got a very extensive encyclopedia of it, but what's helpful is someone diagnosing you with an anal fissure. Usually if you've got those searing type of symptoms, they'll probably find something there, but all it takes is somebody really just looking, spreading apart your bottom cheeks so they can get a very close look. That will help you on your way to therapy. Hemorrhoids. Of course, hemorrhoids can give you burning. They seem to give you like every single symptom in the book. But some specific diagnoses, okay, like an external thrombosed hemorrhoid. That means a blood clot has developed in the outside hemorrhoid. You know that pea-sized or even larger, but a size bulge on the outside of your hemorrhoid. But the difference here is that it's super painful, can be very stiff, and it gets inflamed and definitely causes a lot of symptoms when you're pooping. It can feel like a fissure. People might think they have both, this lump plus the fissure. Either way, definitely can be super intense and a searing pain. And you know, I have a video on thrombosed external hemorrhoids, of course, and just know that your two options: go see a surgeon to get the clot released or opened up to relieve that pressure, or you can leave it alone if it's doing well and the body will heal itself. Yes, it can take a lot of patience because that blood clot can take a very long time to get reabsorbed into your body, and that's when the inflammation will eventually calm down and then the clot will eventually disappear. Internal hemorrhoids can also cause a burning sensation as well, and a thrombosed internal hemorrhoid can make very similar symptoms as the external, like I just described. But an internal hemorrhoid flare can also, yes, do the same burning type of characteristic feel, because that inflammation of the hemorrhoid inside, it's getting squeezed down by your anus sphincter muscle, so you can feel some burning through the day. The poop is brushing by that hemorrhoid whenever you poop every morning and it's inflamed, yes, that can cause another burning sensation on contact. So here's the main message is, of course, yes, seeing a specialist or a doctor who knows how to examine your anus and give you a diagnosis is going to be super helpful. That way you know which direction to treat yourself. The fifth reason for burning while you're pooping, or the burning sensation, is proctitis. Proct in that word means rectum, just like proctologist, and itis is inflammation of, so inflammation of the rectum. Now, this is not exactly close to the anus, so you may be thinking, Dr. Chung, that's like way up there. What the heck are you talking about? But I'll tell you, the way our nervous system is hooked up, the inside in our pelvis, we can sometimes get a feeling, or the brain interprets these signals as being closer to the bottom of our anus, or almost even outside on our anus. So it's just interesting. It depends on what your symptoms exactly are, where your inflammation is. But the inflammation proctitis can be for many, many reasons. Is it because of bacterial colonization, or the flora has been contaminated? Maybe it's from antibiotics. Is there a virus that's causing inflammation? Is there an immune system issue, like your immune system has decided to go a little haywire and you have something called eosinophilia that can create mucus and irritation and loose bowel movements? Could there be something like radiation causing proctitis? Could there be something that's physical contact and friction of nature, like something like maybe you're doing a lot of physical therapy, or maybe pelvic wand manipulation, or anal sex? You know, there's a lot of very vigorous anal sex. It goes for or miles, and you get the idea here. The treatments range from like A to Z as well, depending on treatment. Do you need antibiotics? Do you need antiviral medication? Do you need mesalamine, like anti-inflammatory medication? Do you need sucralfate? And that goes on and on. Just like skin itching kind of treatments and diagnosis, proctitis is almost the exact same way. And it's crucial to get a diagnosis because one treatment does not treat all. For example, if you get steroids for proctitis because it's saying it's an inflammatory process, but in fact you had a bacterial overgrowth, that will not solve the issue. So again, diagnosis is key. And last but not least, this is a diagnosis which is near and dear to my heart. And it's been something I've been researching for the last several years because I find that the patients are somehow filtering to me. I see people like this 10 times a week, and I'm not exaggerating. The diagnosis is internal anal sphincter spasm and muscle injury. Essentially what happens is the anus goes through some type of trauma, like a hemorrhoid banding gone wrong, or you've gone through a fissure that just won't heal and is super painful. The anus then goes into PTSD mode over time and has taken on bad habits which are not very successful in allowing you to have a poop, and then your poops are coming out super thin, or you can find it extremely difficult to pass a little bit of gas. Essentially now your muscles won't relax adequately and they're squeezing so dang hard their muscles are tired out and then give you this burning pain. When I talk to patients and I hear this person say it feels like a burning, my ears immediately perk up and I wonder if this person has it. And the awesome part about this condition is that number one, how common it is. You don't have some weird disease. But number two is that physical therapy, specifically pelvic floor physical therapy, this is the cure for 95% of patients that I find in my office. Okay, it is not a sphincterotomy. It is not even surgery. I tell people always to do the pelvic floor physical therapy first. Okay, and then if it doesn't work out or the pain is too much, then I go to Botox injection. Now I have a video on how I do Botox injection. I've got a pretty specific way which I have found to be helpful for my patients. And the real last but not least is number 7, pudendal neuralgia. And this is a diagnosis where the pudendal nerve, which supplies some motor and sensory to the anal and the genitalia zones, have something wrong with the nerve, whether it is inflamed, whether it is injured. There's something going on that's producing this inappropriate pain message to the brain, and that's what you feel. And the structures inside your pelvis region that's supplied by the nerve are actually perfectly functioning and normal, as that's how it's diagnosed. Because if there was something wrong with those body parts, the nerve should be functioning normal and you shouldn't have any pain. So the thing is that everything looks fine in your MRIs and physical exam, but for some reason you still get this pain. You're like, there's pain, but the doctors keep telling you there's nothing wrong with you. Dang it must be the nerve. They're dysfunctional, they're broken. So they may give you medications, injections to try and treat the nerve itself. And depending on where they believe the dysfunction of the nerve comes from, right, that's how the treatment will be guided. But something like Botox of the muscles, like for internal sphincter spasm, wouldn't really work here because those muscles are functioning normally. It's the nerve. So you might get like gabapentin. You might get like steroid shots. You might get like lidocaine injections to the nerves to try and help you. And this is a diagnosis which has kind of a mystique about it, to be honest with you, because I think this diagnosis is kind of like IBS, to be honest with you, okay? I'm no pro at this. However, IBS is kind of the same thing where a diagnosis is given because guess what? I'm sorry, I don't understand why your bowel habits are flipping around like that, or you get diarrhea all of a sudden for no reason. So we'll call you IBS because it's just not normal and routine like every day. The pudendal I find to be the same. When the doctors and physical therapists don't see anything wrong with you, they say pain comes from what structure? No, nothing is broken. It must be your nerves. So definitely, if you get into these situations, get second opinions, look online, research. I don't think there's anything wrong with research. Looking online in the internet is what the internet is about. Figuring things out, seeing people new, reading things, and exploring. I don't have any problems with patients ever doing research. Never. I tell people to do it. Obviously, if you're getting anxiety, you should kind of taper it off. But it's my job to be able to answer your questions and see and discuss with you. Is this something helpful for you? Is it not? How? I'm learning all the time and I absolutely love doing it. So the symptom of burning can be extremely subjective, right? There are many other words that people use to describe burning, but I wanted to share this to you for you to help you match up what you've got going on so you can give yourself some direction for help. And it's never comfortable to deal with this symptom. Never, not even the least bit. People are become emotionally unstable with these types of symptoms because it's so uncomfortable. It's crazy. It makes you think there's something really wrong with you and it destroys your quality of life. I totally get it, and believe me, everyone like you, and there are a lot of you, are experiencing the same thing, I promise you. And so I really hope that things are getting better for you. And with this, I really do suggest you try Revival XR for burning symptoms, because definitely the sitz bath can be one place where muscle relaxation can take place, but the soothing elements in this powerful sitz bath salt supplement can be very helpful. It's got the oils, all organic ingredients, and the Himalayan salts and the Epsom salts to go with it. Definitely check this out on Amazon. They've given us a code, and I'll see you in the next one. Bye-bye.